we are talking about palliative care, communication, which is something which is very important. And first of all, breaking the bad news is something which has to be done, but which is not done to the patient. Recently, I came across a patient who was suffering from pancreatic cancer, and this patient was a terminal patient, was not disclosed about the disease, living alone, ordering food from Zomato and Swiggy. When the doctors informed their relatives, they came back, they started restricting the diet, and this patient got angry and told the attendants that asked them to go away. Since the news was not broken, why these restrictions? The patient found hindrances in his daily routine, in his eating and habits, etc. So, Dr. Dam, my question is, to avoid such a scenario, how important is breaking news and why is it not done by the medical professionals?
See, breaking bad news is a very important part of the whole communication process. But then, as they say, when you break an egg, you need to break it very gently. Otherwise, you will make a mess of the whole thing. So, similar thing is while breaking bad news, unless it is done in a very gentle and a proper fashion, and what exactly is proper, that we will be discussing in detail in the module which follows. So, this has to be done very gently and with a lot of skill and a lot of compassion, and so that the patient is given small bits in small times, so that the patient digests one small bit before he is given the next mouthful. So, it should be in a gentle and designated manner, and although there are no clear cut guidelines that you should follow this way or that way, so but then you have a broad structure, just a broad structure is given to you, and you should be focusing on the local cultural and social aspects also, because what is true in Western countries will not necessarily be true in various varied cultural situations in different parts of India. So, one has to take everything with a pinch of salt and use their common sense also. So, it's a skill which is acquired by years and years of practice. So, practice is of essence, and having a sense of compassion is of essence.
Thank you. So, basically, what I understand is that breaking news has to be done in a very gentle manner, and there's a definite technique. It has to be learned and grasped. So, it becomes important. And in case if the family members don't want the news to be broken, so they should be told that if they want cooperation of the patient, certainly the news has to be broken, because the patient does not know about the disease and may be non-cooperative. So, Mr. Menon, would you like to say something on this aspect?
Breaking news is a very difficult task, as Dr. Dam has rightly said, but it has to be broken at appropriate time for the for planning the future of the patient. The patient may be thinking that he will be living for a lifetime, say for 60 years or so, but the doctors are aware that he is going to die soon. So we may have plans, we may have dreams, unfulfilled task and all that. So the patient can be given an opportunity to complete the assignments that he has in mind. So breaking news in a way is a very good positive activity, and in my own experience, I have similar situations I had to encounter with, and I found that breaking bad news is essentially needed. But how? Who? Who will bell the cat? Who is going to reveal the truth before the patient? All these are very, very, very soft and very tiny, this an abstract things which cannot be given a detailed definition of when we should say and all that, depending on the locational as well as the mindset of the patient and the family members. We have to have a series of sittings before a truth telling, otherwise it is called truth telling, how the we can tell the truth and all those things to the patient. There may be collusions between the patient and the bystander. The patient may be knowing about his disease, but he just pretends that he does not know it. That is collusion. On the other side, the bystander knows the truth that the patient is having an irreversible disease and he is about to die soon, but the bystander does not wish to share the information to the patient. A lot of pandemonium is already there while we propose to break the news. So first we have to make the the bystanders and the family members aware of the need and the result that they are going to derive out of breaking bad news, and at the same time we will have to empower the patient to receive a message which he does not like to receive. Suppose if a person is about to die, when cancer is on the increase and he does not know what cancer is, and suppose if he is taken to a cancer ward, naturally he is likely to know that I am having something connected with cancer. Why should I be in the cancer department if I am not having any cancer like that? So part by part we will have to disseminate the information of the patient and the family members for their good. The good, and that is the ultimate result of palliative care. The good of the patient, the good of the bystanders, the good of the family members. That should be the motto behind truth telling and what we call breaking bad news.
Thank you, Mr. Menon. So basically, when the news is broken, most of the patients we have a definitive psychological reaction, which may be shortly termed as that. Once a patient comes to know about the bad news that you have cancer, he'll be in the state of denial. No, I cannot have cancer. And this state will continue. Finally, the patient will believe and accept it. Yes, I have cancer. He'll try to confirm from various sources, and acceptance is there. After acceptance, there is agony. Why I get it? Why did not he? He is a smoker, he drinks, and I got it. So now this agony would be there, and this agony will finally lead to depression. So Dr. Dam, how do you think palliative care addresses this depression?
See, a bit of depression is all but natural. It's a natural reaction to feel sad when you are confronted with an issue which you can't change. So that level of sadness, that level of depression is normal. But if it is prolonged over a long time, then this is something which we call an adjustment disorder, right? So, and then if that adjustment disorder is again prolonged, then that goes into different types of psychiatric illness you might get, like you would end up in a full-blown depressive state and anxious state, which would require therapy, actually drug therapy or counseling or so many other things. So there's a big spectrum of the whole thing, depending on how one can adjust to the whole thing, and whether one has familial support or not, whether one is comfortable with the social and cultural surroundings, what is his spiritual support or religious support available for the patient, and so on and so forth. So it's a spectrum which one needs to address, and these will be addressed in detail in the modules to come.
Thank you, Dr. Dam, and thank you, Mr. Menon. So all of us know that important aspect is that we should be breaking the news to the patient, and which is most of the time not done by the family members. They'll ask the doctors not to disclose it to the patient, or the doctor will ask the family members not to disclose it to the patient. But it is very important. As rightly said, you cannot break the news at a single time. It has to be done very gently, because what happens if you are not breaking the news in scientific way, the patient may die because of the heart attack rather than cancer itself. So with this, we sum up the today's session. Have a great day.
Thank you.